is my absolute honour to invite Associate Professor Mitchell Anjou. So Mitchell is the Director of the Indigenous Eye Health Unit at the University of Melbourne and has been involved in the Indigenous eye health space for over 2 decades now. And he has been involved in optometry as a practitioner and public health practitioner and an optometrist for the past few decades as well, and he's had profound impact on optometry and public health in regards to eye care across the country. He will present to us on the most recent eye health data, including eye health measures for Aboriginal and Torres Strait Islander people 2023, and highlight key potential focus areas for Western Australia. If we could please welcome Associate Professor Mitchell Anjou.
Thanks. Thank you, Kaiba. We're meeting today on the lands of the Whadjuk Noongar people, and I would like to offer my respects to their elders past, their elders present, and their emerging and future leaders. I'd also like to acknowledge all of the First Nations people who are in the audience today. Give a particular shout out for your attendance and your participation in this meeting. Thanks to the Western Australian Aboriginal Eye Health Forum for inviting me to speak. I was talking to Angus earlier, and I think I attended one of these in 2013, 2014, or something about that time. So it's a long time between drinks. These are really effective ways of getting stakeholders connected and having conversations that can help to improve the system. So congratulations to the forum for putting this to the forum for putting on the forum. Yeah, whatever. I'm from the East. I'm from the University of Melbourne, and so I want to preface all of my remarks by saying I don't know much about WA and WA Eye Health or WA Aboriginal and Torres Strait Islander Eye Health. So what I'm going to share is just sort of the stuff that I do know or I have observed. It's not meant in any way to be judgmental or directive. It's meant to be a share, and it's for you guys in the West to work out what you want to do with the comments and the information that I'm giving you. So my home base is at the University of Melbourne. I belong to what we call ourselves a bespoke little research group called the Indigenous Eye Health Unit that was set up by an eminent ophthalmologist, Professor Hugh Taylor, in 2008. We have 15 staff now spread around the country, no Western Australian staff member, regrettably. And we do funny stuff. We're funded philanthropically and by government. We're not required to teach, we're not required to research in a traditional sense, but we're given funds in order to try to advance or address or progress the systems that are delivering care to Aboriginal and Torres Strait Islander people. So we do health systems research, we do translational research, taking known practices and putting them into work. Our tools are advocacy, technical advice and support, and we have a few health promotion campaigns that you might be familiar with as well. The first one was the trachoma health promotion campaign, Clean Faces, Strong Eyes, with Milpa the trachoma goanna. Check Today, See Tomorrow, the diabetes campaign. A recent one more recently launched was Eye Care Now, Eye Care Always, encouraging First Nations people to have their eyes checked regularly. And we have a sort of overrunning mantra now of our vision in our hands, which is paying homage to the fact that we need Aboriginal and Torres Strait Islander leadership of eye health. Our original goal was to close the gap for vision. We thought we're on the path to doing that. We don't have the data to prove that yet, but the goal has subsequently been moved to ending avoidable blindness and vision loss. The Australian government set a target for 2025 to have that achieved. I don't think that's going to be the case, but we are trying to contribute or participate to that end goal. Only briefly on me, this is me in pictures. I'm a 63-year-old white fella, colonial settler optometrist. I'm a father of 4, and my most recent news is that my mum died in September last year. She was 86. Dad at 93 is still ticking on, but you can feel the impact of that lifelong partner's passing. And that was in September, and then in October we welcomed our first grandchild. And so little Frederick, or Freddie, is about 6 months old now. This is sort of a schema that talks about some of the work, or the breadth of work that we've involved in. It's reasonably content heavy. You can see passage of time across the bottom from 2008 up to 2025. You can see the measures of blindness that we have from national surveys up the top, the roadmap to close the gap for vision, and our annual updates around systems reform. The various funding bids that have been made through Vision 2020 Australia, the national peak body for eye care, the influence of Australian government policy, and then increasingly this welter of work around Aboriginal and Torres Strait Islander determination of what needs to happen. And so I think that you can see from this graphic the move towards the bottom right about Aboriginal and Torres Strait Islander control of eye health. And then just above the bottom there's a series of reports, which is the AIHW data reports. The goal, I think, now is around ending avoidable blindness and vision loss rather than closing the gap and eliminating trachoma. And you have Matthew Lester who's going to tell you more about that elimination of trachoma. So my information today largely comes from an AIHW report. First of these reports was in 2017. The last one was in 2023, launched in December. We're expecting a new report to be delivered in August of this year. And sometime between now and then, I think there'll be a series of 8 jurisdictional data reports produced by the Australian Institute of Health and Welfare on eye measures at a jurisdictional level. So there'll be a Western Australian report that will come out, which is worthwhile everyone having a look at. The National Eye Health Survey, the original one was done in 2008. Subsequent one was done in 2015, and there is a national survey underway at the moment, the Australian Eye and Ear Health Survey, and we are hanging on the results of that survey, which hopefully we'll get some information probably towards the end of this year or early next year. And that enables us to say at a national level what is the prevalence of the conditions that impact on Aboriginal and Torres Strait Islander eye health. Hopefully you're all aware that there are 4 main conditions that contribute to Aboriginal and Torres Strait Islander vision loss: trachoma, cataract, diabetes and refractive error, and we largely know what to do to solve each of these issues. So in a great sense, Aboriginal and Torres Strait Islander people do not need to be burdened with this vision loss because we have the solutions to each of these problems. And it is a failure of our system, if you like, or our systems, that mean that Aboriginal and Torres Strait Islander people suffer more vision loss and blindness than other Australians. This is national data. So the first one to focus on is eye exams. My feeling, I'm biased because I'm an optometrist, is that you have to have an eye exam in order to determine the problem, in order to begin to treat or fix the problem. And the issue is that we're not providing enough eye exams to Aboriginal and Torres Strait Islander people. There is the visiting optometrist scheme, which helps to provide a certain proportion of services, but in 2023, I think there are 114,000 optometry exams, thank you, provided, only of which less than 30,000 were from VOS. So the bulk of the eye exams that are delivered to Aboriginal and Torres Strait Islander people are not VOS supported. They happen elsewise. My guesstimation is we're about 2/3 there on the number of eye exams that are required for Aboriginal people to meet parity with non-Aboriginal people. So we do not provide enough eye exams, and that is definitely an issue in Western Australia, as you will see. Access to glasses is a natural outcome from an eye exam. There'll be a significant proportion of people who have their eyes tested who need to have glasses. And you can see there, don't note too heavily, the Western Australian part of the histogram there. Our assessment of the schemes that support supply of glasses to Aboriginal and Torres Strait Islander people is probably in the worst state in WA of all of the jurisdictions. This is the government subsidised scheme that we're talking about, not other initiatives that might be in place. There was an Australian government initiative started in 2018 that drifted on through COVID years up to 2024 called the National Subsidised Spectacle Scheme that really didn't have a lot of impact, although there was some attempts to do some work in the West. Diabetic retinopathy, or the screening of people with diabetes, is a key issue for maintaining eye health. The 2015 data showed that we'd moved the wheel a little bit, that it was in 20% of Aboriginal people with diabetes were getting their eyes checked each year. In 2008, that went up to about 40%, 40 or 50% in 2015, and we don't have another data point, but we're only about halfway there, and there is an inequity. Non-Aboriginal people have a higher rate of regular screening than Aboriginal people. So I'm really pleased to hear about the use of the cameras, Jess, and all of the work around supporting health workers to use that. Cataract, significant increase over the years across the country, but we still only probably 2/3 to the needs of Aboriginal and Torres Strait Islander people to have cataract surgery. And the key issue is the lack of public cataract surgery. So I'll show you a graphic in a minute that shows that some of the increase of cataract surgery is happening because private ophthalmology is providing more services rather than the public delivery of services. And you will know that Aboriginal and Torres Strait Islander people are more likely to engage with the public system in order to try and receive services. And that's an area of non-growth. Trachoma is a good story. We are under 5%. I expect, and I'll be interested to hear what Matthew says, that there'll be a dossier, thank you, delivered to the World Health Organisation probably in 2025 that will allow for the certification of Australia having eliminated trachoma. So it looks like for the past 3 years, 24, 23, 22, going backwards, we will have less than 5% prevalence of trachoma in the areas that need to be measured across the country. Outstanding success there, largely due to the support and contributions of community-controlled sector to get on top of that. So I think broadly the gap for vision is closing. We have improvement in blindness rates and vision loss. We have reduced prevalence of trachoma. We've got increase in cataract surgery. We're providing more eye exams, but not enough. And diabetes screening is on the way up. Some thoughts around WA. 715s, the screening step, a key element to find people who might have vision problems to set them on the pathway of care. So I encourage the consideration of support for the community-controlled sector to try to increase as best they can their 715 rates and to make sure that vision is part of the screening. It's meant to be, but it needs to be part of it, and then you can find the people that need to have the eye exams. So hopefully everyone can read that. WA is on about parity with Australia in the delivery of 715s, but you'll see that across the various regions in WA, there's not an equivalent delivery of 715s in each region, which means that there's a patchiness in how they're delivered, which is going to be largely due to how the community control sector is prioritising perhaps their work. Eye exams. Now you see here that WA probably performs worse to all other jurisdictions other than the Northern Territory in the delivery of eye exams. Now I don't fully understand this, and there'll be people that work locally that know more about it, but clearly we are under-examining people in order to, so under-identifying them through 705s, under-examining them in order to find those that need refractive error correction, need to have cataract surgery, etc. The supply of the VOS seems to be on reasonable parity with the rest of the country. Here's some data on subsidised spectacle schemes. And the thing, this is AISW data, the thing that you'll notice here is there's no WA here. And there's no WA here, not because nothing's being provided, but because the WA system does not count the number of glasses that are provided to Aboriginal and Torres Strait Islander people. So we haven't got any data from which we could begin to leverage the system of supply that says that we need to be providing more subsidised glasses to Aboriginal and Torres Strait Islander people. Glasses are a key driver for people to get their eyes tested. So accessible, affordable glasses are a key driver for good eye health across the country and WA. You've got a problem here in WA with your subsidised spectacle scheme. Cataract surgery seems to be going okay here, I think. Variation across the regions. And I mentioned before about the increase of private. The bottom left graphic there is that increase of private supply of cataract surgery and the relative stability or sameness in the public supply. The other issue here is that there's a widening gap of waiting times between Aboriginal and Torres Strait Islander people for cataract surgery in the West compared to other Western Australians. So that is normally an indication of something in the system that is biased against First Nations people. So potentially an issue there. Final slide, I think, with information is that there's probably a workforce issue as well. I'm sure that the setup of the optometry school at the University of WA will go some way to doing that. But in both ophthalmology and optometry, you can see that the rates of practitioner to head of population is on the low side for both optometry and ophthalmology. So you have an unsupply of those practitioners. And I hear Jessica and others talking about the need for Aboriginal health workers as well. And with another hat on, I would be pumping that arm as well. So I'm convinced that we're on a path to closing the gap for vision. I'm convinced we're on a path to ending avoidable blindness and vision loss. I think we need to think about data. We need to be aware of data so we can monitor progress over time. We also need to be thinking about the leadership of the eye health space. And I think we should all get behind and support Aboriginal and Torres Strait Islander leadership of eye health, because our systems change have gone so far. The next step is for Aboriginal people to take it, make it one of their issues and solve the problems in their entirety for us. Thank you.